So let's go to each one of the components. So first, we should consider these factors in the condition of the aesthetic patients. So the person who gives the consent should be an authorized person, meaning the authorized person we are pertaining here are the patient receiving the treatment or the guardian when the patient is a minor or under any circumstances that he cannot or she cannot decide for him or herself. So the only authorized person who will give us consent should be the patient and or his guardian only. The second is the decisional capacity or the autonomy of the patient. The person who gives the informed consent has the decisional capacity. This is the most important of all. The patient is competent and has self-determination right and can decide with autonomy in relation with his or her own body without any coercion and can legally capable of giving the consent. And if the patient is incompetent, which we seldom encounter in our practice, in our kind of field in medicine, their guardian must decide and give informed consent to an aesthetic procedure on patient's behalf. So the decisional capacity of your aesthetic patient is affected by different factors. First, sufficient age. The age of the patient on what age he or she will be going to give consent varies in your country or state, but mostly it is at 18 years of age. The second one is the ability to understand the nature, the possible risks, and the anticipated benefits of the proposed intervention. The patient, your aesthetic patient, should have the ability to understand the treatment, the risks, and the complications it has, and the benefits for the proposed intervention. The patient also has the ability to use those information provided to him or her by your practice or the provider to come to a freely chosen decision. It should not be forced. And his own capacity has the ability to come to a freely chosen decision. And not mentally impaired so as to prevent misunderstanding. So one of these factors deserve further discussion, as one scenario specific in aesthetic practice is when we deal with a healthy patient but with exaggerated wishes and artificial reasons due to psychiatric gains. Thus, doctors must carefully interview and consider psychiatric disorders, such as those with body dysmorphic syndrome, mood disorder, personality disorder, and the like. Patients with BDD or body dysmorphic disorders have little or no insight into their illness, and if found out, they have no competency in giving informed consent. So these problems may worsen after aesthetic procedure. So those patients with BDD or body dysmorphic disorders tend to not be contented with what they got from the treatment, from all other treatments. And they are not satisfied at all. So, if that's the case, then they have or they are not competent in giving informed consent. And then the last one, a judgment not compromised by illness that clouds his decision-making capacity, medications, or an alcohol. If he or she is under the influence of alcohol, then she is not capable or incapacity of giving informed consent. The person who gives the consent voluntarily gives it and should not be forced. So there should be no coercion. The patient should be freely given time and should give it freely to you and your practice. The person also who gives the consent should be fully aware and conscious at that time consent is being asked. The patient should be in sound mind while giving his or her consent. You should not ask the patient for his or her consent while he or she is lying on a surgical theater under anesthesia and she is few sleepy and a few minutes away from not being awake. So it's a no-no for you to give or to ask for a consent when she is at that time lying on a bed and under anesthesia. Patient also should fulfill all the obligations for the informed consent. In his side, the patient should fulfill his or her obligations. So what are these obligations? The patient's signature is necessary whether he accepted the treatment or rejected it. It is also necessary to read the consent carefully, understand the medical procedure and aesthetic procedures, and inquire before signing the consent form. The patient or his or her guardian should disclose all medical history and problems, all previous non-surgical and surgical aesthetic procedures, since this can affect the outcome of their treatment. The patient is also expected to be committed to aesthetic procedure instructions. He or she should follow all the instructions given to him by his or her aesthetic provider.